Thank you so much, and good morning to all of you. Let me invite my panelists to join me up here on the stage now, and we'll get started momentarily. As you heard from Attorney General Becerra, we are really facing one of the most crucial periods in our history when it comes to defending and protecting and extending the right to health care. So what you're going to be hearing about shortly is a terrific discussion from several panelists who are in the midst of the fight. As the Attorney General said, you and your families are the essence of this fight, and these three who we have with us are carrying that torch loud and clear. What we're going to be talking about is, first of all, what have these folks accomplished in their unique realms over the last year? What do they think are the key issues that they will be working on? Much of it will track with what all of you said in that Instapoll result. It's going to be about equity. It's going to be about affordability. It's going to be about preserving and extending and expanding Medicaid, particularly in the states that have not done so. So you'll be hearing all of those themes over and over again. And I think you're going to be hearing from each of them a challenge as to what can be done now by all of you between now and the November elections to continue to broaden the base, broaden the group of people who care about these issues, and push these issues over the top in November and beyond. So I'm very delighted to be joined, first of all, by Ola Ojewumi, who's the healthcare consumer and advocate. Ola, thank you for being with us. Also by Marielena Hincapié, am I getting that right, finally? I had to practice, but there I've got it. And who is with the National Immigration Law Center, and Michele Johnson, who's with the Tennessee Justice Center. So welcome to all of you. So we're going to start, again, by hearing from each of them of what they've been working on most recently, what they've accomplished, what do they think are the big challenges ahead, and how they need your help. So Ola, why don't you start us off?
Well, thank you so much for that wonderful introduction. I'm so happy to be here. I founded a small nonprofit organization when I was 19 called Project Ascend, and we fund college scholarships for disabled youth in the Washington, D.C. metropolitan area. And I'm also a healthcare advocate. I've lobbied Congress for reduced costs for prescription drugs, and lobby towards keeping the ACA alive and saving it from repeal.
Great, thank you so much. And just before we go on, say a little bit more about what you think are the most important things that you've accomplished at your organization over the last year.
But the most important thing that I've accomplished within my organization is propelling the importance of healthcare equity within disenfranchised communities, meaning we talk about equal access to healthcare. What does that mean? That means eliminating things like unconscious bias and racism within the healthcare system, and that also means asking doctors and medical professionals to confront their unconscious biases that allow Black women, women of color to continue to be harmed within hospitals and lose their lives, as opposed to receiving equal treatment, adequate care. Instead, we're receiving racism, bigotry, and we're in consistent pain because of discrimination.
And what do you think the message is getting across? Are you seeing the healthcare system wake up to this issue of unconscious bias?
I've seen a little bit of conversation and discussion, but it's extremely difficult to ask doctors and healthcare administrators to be accountable. I'll give you an example. A doctor actually recently commented on one of my Instagram photos. He's a doctor in New York, Dr. Evan Rodriguez, and he told me that I took a heart from someone else and am still asking for handouts.
Whoa.
I am not on Medicaid, I am not on Medicare, I'm not on SSDI. Not that there's a problem with that. I work full-time, 40 hours a week, and I pay for my own health insurance. But that's an anesthesiologist that has the power to say that. What are they saying behind closed doors?
I wouldn't even call that unconscious bias. That's just outright flagrant conscious bias, and not to mention worse words that I could think of that my mother would not be proud of me to say. But, well, thank you for fighting that very important set of fights. Marielena, let's go to you. Obviously, we're in a period where everything we're seeing with respect to immigration, policy around refugees, policy around asylees seems to be going the wrong direction. And then, of course, there's the public charge issue as well. Tell us about what's been foremost on your plate.
Sure. Well, first of all, buenos dias. It's wonderful to be here at the Families USA conference. Families is one of our most important partners at the National Immigration Law Center, and we share a collective vision of achieving healthcare for all and building a more equitable and inclusive society for all of us, and a healthier society for all of us. So at the National Immigration Law Center, as you can imagine, since the elections, we have been battling this administration. So much of our strategy has been to basically delay the harm or to block the harm. And that has meant everything from suing the administration on public charge, which we, on public charge, but also on the Muslim ban, Muslim and travel and refugee ban, which we have the anniversary coming up next Monday. The Supreme Court has allowed the Muslim ban to actually remain on the books. That is now the law of the land, and so that has meant we've also had to sue over the waiver provisions. We've sued over DACA to stop the administration from terminating the DACA program and putting immigrant youth at risk of being detained and deported. Immigrant youth who call this is their home. They know no other country except the United States and are Americans at heart. And with public charge, which is really what we believe to be perhaps the greatest threat to our legal immigration system and to our democracy, and I'll talk more about that work.
And just for those who aren't deep in the weeds on this issue, just give a brief definition of the public charge rule and why it's
absolutely.
What's
so
at stake.
Public charge is was one of the first policy proposals that was floated and leaked by this administration. And although the rhetoric is about undocumented immigrants using public benefits, et cetera, it's actually a radical change to our legal immigration system. For the first time in our country, this administration is putting forth a racial wealth test about who gets to remain in this country and who gets to leave. So for immigrants who are legally eligible for many of these programs, if they have used this program, any of these particular certain benefits like healthcare, nutrition assistance, or housing, they could be denied a green card and have the ability and the freedom to remain in this country with their loved ones. It also means that people coming in the future would be, and ultimately this is not just about changing the legal immigration system, it's about our democracy, because these are future citizens and future voters that will be disenfranchised. And that's really what's at the core of the administration's intentions behind the public charge.
And so far it's been blocked, but
Yes, absolutely. So the courts have served as a really important check and balance over the last 3 years in all of our lawsuits, including on public charge, but it is hanging by a constitutional thread. Right now, there are a number of lawsuits, and the Second Circuit Court of Appeals is the one that has kept the injunction in place that's blocking the administration from implementing it. But the administration has leapfrogged, and they're not following any procedures, legal procedures. They have appealed to the Supreme Court, and we are hoping that the Supreme Court will decide not to hear the case and leave that injunction in place, and we can get a decision on that any day now.
Great. Thank you so much. Michele, what's on your plate in Tennessee, where obviously one of the many states that has been torn apart by the issue of expansion of Medicaid, among many other issues?
Yeah, thank you for having me. Honored to be here in the 25th year. I've been doing this work for 25 years and always leave completely inspired by you all and ready to go out and fight. I mean, let's be clear. The reason why I'm up here is because Tennessee, don't want to brag, is by far winning the race to the bottom in terms of taking, I'm bragging, taking healthcare and turning it into a political issue as opposed to rolling up their sleeves and solving some problems. And so we've been working on both trying to get our elected officials to engage around clear policy solutions that every other state seems to be figuring out, like expansion. We're #1 in the nation at hospital closures. Infant and maternal mortality are going in the wrong direction. Life expectancy is going in the wrong direction. And meanwhile, they want to focus on political games. And so examples of that would be work requirements. Last year we had we threatened to be the first state to apply work requirements to moms, to the core Medicaid population. And then winning basically the race is a block grant that would be the first state in the nation to block grant Medicaid, and it's a hugely dangerous proposal that really puts at risk all the fundamental partnership that is Medicaid.
That's all?
Oh no, that's not, but I'm gonna give somebody else a chance to talk.
So what is your sense going into the election about where the public is on these issues? Obviously, for a lot of states, it was a big wake-up call when the effort arose in 2017 to dismantle the ACA, because people finally figured out what was in it, including the Medicaid expansion. And of course, in places like Tennessee, a lot of people are highly dependent, as you said, on Medicaid.
Yeah, I mean, I have been doing this work for 25 years and 5 months, and I have never, ever been as hopeful as I am today. Never been as hopeful. And that has to do with the fact that something in 2017 happened that we've been all trying to do forever, and people are connecting their righteous indignation and frustration with their own experience and the experience of their loved ones with their neighbors. And that is really exciting to figure out how we, tired and battered and just traumatized, how can we hold on and channel all that righteous indignation into real change?
Let's talk about what all of you think are going to be the most powerful messages to convey to the public. And in fact, let's think about what is really going to be persuasive to people who may not think that these issues are front and center for them. So Marielena, let's start with you. You can go find some very well-intended people in this country who have a lot of suspicions about immigrants and immigration. What do you say to those people about why they need to care about things like public charge, like the Muslim ban, et cetera?
Yeah, I think it's a really important, Susan, and I think that the part of what the research shows is that there's a reason why the majority of Americans have healthcare as their top issue, because we all get sick, right? Illnesses do not discriminate. Everyone gets the flu. People can get pneumonia. I mean, it's reminding people of our humanity and dignity, because that's ultimately what's at stake. I'm reminded of, Ola, the comment you made in the video about what's really at stake in this election is about our humanity, our dignity, and it's about life and death, right? And reminding people that actually the powers that be have rigged the system, and that at the end of the day, the system is not working for any of us, and that we absolutely need to work together across communities, across race, class, able, disabled, all of us need to come together to ensure that we take our country back, right? That this country isn't working for the majority of Americans, including new Americans who are wanting to come to the United States, just like generations of immigrants and refugees have come, so that the United States continues to be that place where it's a beacon of hope, right? And reminding, like, we're experiencing collective trauma in this country imposed by this administration, and we are all suffering, and we need to build on the hope. I think one of the things, as you said, Susan, that gives me a lot of hope right now for the elections is that so many people have been politicized, so many people who are engaging in electoral work, and we need to do even more than that, and also be able to vote for those that don't have the right to vote right now. So I'm actually very hopeful, and I know that the stakes are so high in this election. It requires every single one of us to do more than we've ever done. It's not a time to be sitting by the sidelines, but for us to take every step to make sure that we're voting for all of us. It's not just on behalf of any one of our communities, but for all of us and who we're becoming as a nation.
Ola, what do you think are the messages that are going to be most powerful?
Messages, particularly in the disabled community, that are going to be most powerful are obviously healthcare, but in terms of voting accessibility, how many of our polling places are accessible? Not very many, so that presents a barrier. And the disabled population in this country is the largest minority across race, across gender, across sexuality, across country of origin. We are the largest minority. There are about over 50 million of us. And we are a huge part of the voting population. And you wouldn't believe how many disabled people voted for Trump between voting for Hillary. And it was 50-50 split. You would think people wouldn't vote against their own self-interest, but 50% voted for Trump, despite the fact that he mocked a disabled reporter. And so within my work is trying to get the disabled population to understand privilege and not select their racial privilege over their disability identity and what they need. And when I say racial privilege, is the population that is voting for Trump tends to be white, disabled people, veterans. And just because someone's a wheelchair user or someone's disabled does not mean that they do not have privilege. They still have white privilege and they still may have wealth privilege. And that can often cloud their better judgment. So mobilizing the disabled community to vote more and mobilizing public policy and public policy leaders to make voting accessibility a top issue and policy priority.
So that's a really powerful message. What can those who have essentially a slightly different area of focus, really concerned about any of these other issues, what would you say they should be doing on that particular issue about accessibility at the polls?
Contact your local polling place. There's always there's before the election, of course, but interrogate your county governments, local governments. Is this polling place accessible? Also, just like phone banking is very easy, you can contact disabled people and say, do you need a ride? Every single one of us knows someone who's disabled. They might not be visibly disabled, but they may have a hidden disability. I'll give you an example. Serena Williams, top athlete, Serena and Venus. Venus has Sjogren syndrome. Who would know? Serena actually suffers from chronic blood clots that actually, nearly killed her before she gave birth, and, during birth, and years before, as an athlete. I mean, it's just organizing your community. Don't be afraid to talk to us. Disabled people don't bite. And there are people, statistically, there are people who are even uncomfortable having a conversation with a disabled person. But remember, their vote matters too, and you make your community accountable and be accountable yourself.
Great, okay. Thank you so much. Very, very, very powerful. So Michele, what do you think, what are the messages? You said you have a lot of hope. There's been a big wake-up call. What are the messages that are going to get people, mobilize people who care about these issues to the polls?
Well, I think that the fact is that there's so many attacks that are happening at the federal level and the state. There's creative ways that legislators right now are coming up with ways to divide us and to basically say we can't afford to take care of each other. And so taking whatever the little games are and breaking them down into simple values-based messages, and then making it really easy for people to make their voices heard. I mean, healthcare policy is something that most people I just don't have time to understand it, but we've made huge progress in this room in making it simple and then using technology to enable people to really say, this doesn't match my values, and enabling them to be leaders within their own community. So, I mean, I feel like what is the message? In many ways, it's like, how do we respond to all the sneaky, horrible, divisive things that are happening around this nation, because they're overreaching. And so if we can just break it down and make it simple, we win.
Great. Well, and as we know, one of the most powerful things that resonates with people are stories. And Families USA's Story Bank, collecting just hundreds, if not thousands, of stories of people. Peter talked about the importance of his own story and conveying his story to lawmakers. What are the stories that you can tell yourselves? And what can you share with the audience that basically illustrates the effect of some of these issues, the Muslim ban, the public charge in your case?
Yeah, I mean, I would say, so yes, and so grateful for Families USA leadership on those stories, because we do believe that that is what will change hearts and minds. At the end of the day, part of what we need in this country is a people-centered approach to all of our laws and policies, in particular to our healthcare system, and that's no different on immigrants and immigration. And, when I think about public charge, I think about my own story, which is, I came when I was 3 from Colombia. My parents were factory workers in the textile industry in Rhode Island, and we relied on food stamps and we relied on community health centers as our way to make ends meet when my parents were laid off from their factory jobs. And the fact is that today, if we were migrating from Colombia today, that would mean that my family would be excluded, that we would not be able to get green cards and become full participants in our democracy. And today, among my 9 brothers and sisters and I, there are educators, health professionals, both in the physical therapy world, in leukemia, a biochemist, I'm a lawyer. I mean, our family is an example of what makes America great. And despite what the Trump administration thinks about immigrants, and when we look at what's happening today, the fear, I mean, this administration is governing through fear. And, you know, we have, there's a family in Southern California whose teenage son almost attempted suicide and almost died because of mental health concerns, that his family was afraid to seek medical care. And he went to the emergency room when he attempted suicide, but even after he was released from the emergency room and even after he got referrals to mental health support, his parents were afraid to seek care because they're afraid that they would get detained and deported. And lastly, I'll share the story of a doctor who sees many patients who are undocumented, who's talked about the fact that every time there are ICE activities in their community, the consumers do not show up. There are days when their clinics are completely empty because people are afraid to come for their medical care. And you know, I'll use the quote that she's used because I find it very, very powerful. And you know, she says that in addition to the physical consequences of that fear, she quote, "It's fear induces a terrible thing to live in chronic fear. It really destroys your body, your mind, and your reason for living." And that is what's at stake, people's ability and freedom to thrive in this country.
Great. Well, I just want to point out we're going to open this up to questions and comments and short speeches, perhaps masquerading as questions from all of you in the audience shortly. But so please get ready if you do have a question or a comment for any of our panelists. We'll be coming to you in just a moment. I want to come to Michele, though, and ask about stories that you think are really going to be resonant.
Well, I mean, I think that there's no question that the way that these policies have been pushed are myths, you know, often racist myths and just myths about who the people are that these programs and the ACA actually helps. And so being able to just tell the full story of who is being helped is something that is just vitally important. I know that most Americans, no matter their political party, if they were able to hear the stories of the 1,500 people who we help each year, they would be furious. They'd be marching in the streets because we have moms who are pregnant and who are desperately trying to get health care in the year 2019. Like, that's 2020 now, but we had mom after mom pregnant who could not access prenatal care. Some of them had life-threatening illnesses. Why? Because red tape. And we have the Trump administration proposing a way to make it easier and pushing states to have more red tape. The stories are going to change hearts and minds, and we all have to make sure that we're telling all the details. These people who rely on this are changing their communities, and their love and their work and sacrifice is something that they sometimes can't even appreciate themselves because of what you're saying. The internalized, constant fear of needing a safety net is so there's so much stigma, and we can work to undo that and say, there's no harm in needing help because you're actually helping people while you're needing help.
Right, and of course the evidence shows many people who depend on some of these programs eventually move off and don't depend on programs and become the kind of contributors to society that, as you've described, Marielena, your family obviously very much became. All right, so we are going to open it up to some questions and comments. It's a little hard to see with the light so bright, but if you have one, please raise your hand. Okay, let's go right here. Why don't you come ahead, stand up, and just go ahead and ask your question. And here's a mic coming right to you.
So I'm from Charleston, South Carolina. These are my colleagues. One of the things that concerns me is I really believe what the young man said on the video, is that healthcare is a right. It's a basic human right. And until it hits you that somehow you're being denied that right, maybe it doesn't come true. So what you said about these are stories and they translate, we have to tell those stories, that it's not just these kind of people or those kind of people who need that access to care. It's really all of us. It's a human race.
That's right.
But one of the things I did, and I do want to have a cautionary note, is and just keep in mind that mental health care and health care for those with substance use disorders is also very real and leads to a lot of other critical illnesses. So language matters. It really does. And so when we talk about people with substance use disorders, we wouldn't call them dope fiends. And I'm saying that not to point out anything other than I care about your issues. But I do. We all have to care about everybody that's different from us. But 72,000 young people died of opiate overdoses last year, and that's a health crisis. So I don't call people with substance use disorders dope fiends, and I wouldn't make fun of someone with disabilities either. So we have to as we're talking about sensitivity, we have to remember the other people in the room.
Well, and thank you for bringing that up. And actually, that's a good question to push to Michele. Given what has happened with opioid use disorder, with methamphetamine use, which also has skyrocketed, heroin use, et cetera, is that changing people's perception? We know many, many people who live in states that have expanded Medicaid have gone on substance use treatment programs as a consequence of Medicaid expansion. Is that doing anything to change the political perception of these programs?
It's a crisis because, like in our city, Nashville, it's booming. We can't find people to work jobs because we have this addiction crisis, and and then we have proof in states that expanded, they're less likely to have opioid issues. So also we have hospitals closing, and we have people who aren't able to get jobs because their main employer just left. So yeah, I think that there's no question that legislators are focused on the opioid crisis. Sometimes their solutions are a little bit not quite right, but that's why it's important that we're here and we just keep reminding them about real solutions.
Ola?
In response, I will not be tone policed. White drug users are not called dope fiends, black drug users are. As someone who actually uses As someone who's treated at a pain management clinic, in order for me to get a pain prescription for oxycodone, I have to go through hoops and battles. The only reason language is being monitored and this is being prioritized is because, for one, substance abuse is a white issue. And I will say this, I had a heart transplant and kidney transplant 5 hours apart at 11 years old. At week 1, I stayed 2.5 weeks in the hospital. In response to my pain after week 1, I was told to take a Tylenol. Statistically, even children, people of color with illnesses, are less likely to get pain medication than white children who are getting a root canal. So this is an issue for me because people with disabilities are criminalized as a result of it, and I have to sign a contract. And if I go and get a prescription from my own transplant team, when I'm released from the hospital after surgery, I can get called by the DEA because of a contract I've signed with my pain management clinic, and this has happened. So I am living the opioid crisis as a result of public policies meant to protect white children and white people with opioid issues, and as a black person with a disability, I suffer more as a result.
Thank you for sharing that just incredible powerful perspective.
Susan, if I could just add just really momentarily, because I just wanted to echo what Ola just said, I think that, and I really appreciate the question because language does matter. Language is really powerful, right? Like, there's a reason we at the National Immigration Law Center are against the word I, right? There is no human being who is illegal, right? There are activities that are illegal. But we also have to remember that part of what's happening in this country right now, and part of what we are unveiling under this administration, is that race and class are being used as wedge issues to divide and conquer, because it has been a proven strategy. And we have, Black and brown people have been criminalized, poverty has been criminalized, and there is different treatment, right? There has been a health epidemic in Black and brown communities for decades, if not centuries, but that was not seen until now as the opioid crisis, right? As that racial privilege that you were talking about earlier, Ola. Same thing when we look at what's happening. I think this goes back to what are the messages that resonate. We need to be able to fighting for all of us and recognize that part of what's happening right now, the strategy, is that with the changing demographics in this country, this administration is absolutely trying to change what we look like as a nation and who is considered worthy of being an American, and how to even redefine basically the soul of our nation. And it includes Black and brown people not being considered being worthy of being an American, even if you were born here.
Yes.
So I think we have time for one or two more questions, if there is one. Please, looks like way in the back, okay? Go ahead and stand up so we can get a mic over to you. And if you don't mind, introduce yourself by name and affiliation, that would be super.
Hi, everybody. My name is Sherry Pratt. I'm from Connecticut, and I am not affiliated with any organization. This is a personal battle for me. Two quick questions. One, how do you get people who have insurance through their employers to understand that that may not always be? Because that's what I struggle with. And then number two, how do you get people to understand that we're all alike? Like you said, the race and the class shouldn't mean anything.
Oh, Michele, what messages, in your experience, resonate with people who have employer-provided insurance, probably is good insurance, don't necessarily think that they're at risk of losing it?
Yeah, I think the Trump administration has helped us out there with, putting at risk the pre-existing condition. So everybody who has private insurance has somebody in their family that is at risk with this, thank goodness that we have the Attorney General fighting this lawsuit to protect the pre-existing conditions. But I promise you that people are connecting it. They're hungry to connect it. They might not have all the way, but they're so close to connecting it, and really I've never seen anything like it. So the pre-existing condition thing is a really important thing, and also just saying, like, do you know anybody? Do you know that 50% of the kids in our state rely on Medicaid? Many states have huge percentages of people, seniors, 3/4 of the people in long-term care relying on Medicaid. And then in terms of the ACA protections, that's really important. In terms of like caring for their neighbor, I do think it's your point, like they're trying so hard to divide us, and we all understand that we're inextricably intertwined. We understand it in our heart. We understand it no matter what we're saying and doing. And so it's like, how do we keep focused on the fact that there's something happening in this nation that hasn't happened in a really long time? And if we can just, all exhausted as we are, and how do we we're on the 5-yard line. How do we just hang in there together and get it across? Because I think the healthcare bidders of this nation are ready. They're ready.
And one issue that should resonate even with people who have employer-provided insurance is affordability. Mm-hmm. Is that cutting through? Oh,
I have employer-based health coverage. I've never been on Medicaid, and when I had my heart transplant, the way that I resonate this with people is, quote unquote, being born normal. I was born an average kid, got diagnosed at 9. I went from just being average to having a heart condition to a year and a half later waking up in a hospital, them saying I had received a heart and kidney transplant. It can happen to everyone. And the way that I convey this in terms of employer-based coverage, my mother doesn't have health insurance right now. And I depended on my father's I depended on my father's employer-based health coverage until I was 26. And it paid for my surgeries in total, 17 years ago were $1 million. If my dad lost his job, I was out. And the way I convey it to everyone is each of you see me as different, or disabled people as different, but each and every one of you will become one of us. Disability affects everyone. If you plan on living to old age, you don't see a lot of older people running triathlons. Naturally, the body breaks down. And if you see how your parents or your grandparents have lived differently because of their disability and have been treated differently, just remember that is the story that matters the most. It will become you. You are slowly getting to that age, and that's why it matters.
Great. Again, a really powerful way of putting it. All right, let's just take up 2 more questions before we close. One is, as we heard, the Supreme Court, of course, decided yesterday, was it yesterday or the day before now? Day before, not to take up the case of Texas versus the U.S. at this juncture. As the Attorney General said, it's probably going to come back to the Supreme Court eventually. How powerful a message is that going to be in the context of this election campaign, that the ACA still remains a threat, indeed could still be ruled completely unconstitutional? Marielena.
Yeah, I mean, I think it has to be, we have to make that a continued priority for the American people. I mean, the ACA is one of the most progressive policy victories that we've had, and it's still not enough, right? And we have to keep fighting both to protect that and to build on that so that we have ultimately, frankly, Medicaid for all, right? Healthcare for all, where we do understand that as the richest nation in the world, we should have healthcare as a human right. And how do we actually make that happen? And so I think one of the things that the right understands very well is the importance of the judiciary. This administration is getting that through all of their nominations in the Supreme Court. And so reminding people of what's at stake and not to take for granted that the ACA will remain the law of the land. And it is the law of the land because we all collectively in this room have fought for it and continue to fight for it. And that's true on all of the other legal battles that we've been able to have. So I think it's very important to remind people of what's at stake, but also to build on the hope, to build on our power of what we've been able to accomplish and to build even greater, greater care for everyone. And that's affordable and quality care.
And I guess this might be a point where I could tell my own story about having seen a T-shirt a few weeks ago, this was before the holidays, saying, "All I want for Christmas is for Ruth Bader Ginsburg to live forever." Right? Making your point. Okay, so Michele, what about the ACA and how are you going to frame that argument in Tennessee?
Well, I mean, I think the issue has been hard to get the media to cover, because everybody just some people don't even remember a time before pre-existing conditions. And so the radical nature of the decision, both at the trial court and the Court of Appeals, it speaks to why the judiciary is important, and so getting people to believe that this is a real threat has somehow been challenging, but it also brings us together in a way that's important, and so we'll keep trying to tell people, and of course our Attorney General joined in that case. It's not a really politically savvy move.
On the side of...
Right, so yeah, I don't understand. I think they thought it was like a little political game they were going to play, and now it's interesting to be able to hold them accountable for that and make sure people understand what the games will put at risk in terms of their families.
And let's just close with a question of affordability. As I mentioned a moment ago, that does seem to be one that would cut across many, many income groups, racial, ethnic categories. Everybody is struggling with the cost of healthcare. Ola, what messages resonate there?
I would say 2 things. I do talk about my mother and how much she makes for $50,000 a year, and her health insurance will be $700 a year. So she just chooses not to have it, and that breaks my heart. And she has diabetes and high blood pressure, and I sit here with health insurance from my employer. That breaks my heart. And unfortunately, we use this thing in the disabled community called super crip syndrome in our storytelling. As problematic as it is, we use the stories of disabled people who've achieved extraordinary things. I often talk about my friend Haben Girma. She is the first blind and deaf woman to graduate from Harvard Law School, and she's a Black woman. And I talk about how health insurance allowed me to go to college for free because I didn't have to constantly worry about getting kicked off my father's insurance. Transplant patients, my friends, they would get loans and withdraw with fail, WF, just to prove that they were in school and could stay on their parents' health insurance. I never want to go back to that. When you give people the security of health insurance and affordable health insurance, you give them the world. I wouldn't be able to work full time. I wouldn't be able to have a college scholarship program for kids if I didn't have that security. So that's why affordable health care is so important.
Well, I think you all have heard loud and clear the messages that these three amazing people think are going to resonate the most. First of all, that we're all in this together. As Marielena said, everybody gets sick. Nobody gets out of this world alive, right? So turns out we've all got a stake in this very important set of equations. Number two, resist the notion that we should be divided from each other, right? Because we are all in this together. And the connection points of society now are so large that any effort to divide us is going to come up against the reality that we are all intertwined. And then finally, I think more than anything else, the stories, getting across these stories of all of these individuals from different walks of life, the 50 million disabled people who may not be able to get to polling places, of the pregnant women in Tennessee who cannot get prenatal care in one of the richest countries in the world. The immigrants who are not going to come and make this country great. Let's go back. Why does everybody want to go see the play about Alexander Hamilton, right? One of the most compelling immigrant stories our nation will ever have, right? Who gave us so much of the fabric of our nation. We've got to connect people to these very important threads in our history and tell them why it matters in the present. And I can't think of a better group of people to have made all of these wonderful points this last half hour or so than these three. Join me in thanking them for a terrific discussion. Thank you.